Hello everyone, I'm Dr. Stephen Grant, and today we're going to talk about a topic that men over 50 often avoid discussing: masturbation. Now, before you roll your eyes or shrug it off, let me be clear. Masturbation is completely normal, natural, and when done thoughtfully, can even be beneficial for your overall health. The problem is that as we age, certain habits can quietly drain your energy, irritate your prostate, and even reduce sexual pleasure with a partner. Many men don't realize how much their habits matter, and the negative effects often appear slowly over time. In this video, I'm going to walk you through the most common masturbation mistakes men over 50 make and share practical, actionable tips on how to avoid them. By the end, you'll understand exactly how to enjoy yourself in a way that supports prostate health, preserves energy, and maintains confidence and vitality, both in the bedroom and in everyday life. Mistake number 1: excessive frequency. Let's start with frequency. Masturbation itself isn't harmful. In fact, it's a natural way to relieve tension, stimulate blood flow, and support prostate health. But frequency really matters, especially after 50. When you're in your 20s or 30s, your body can handle daily or even multiple releases without consequences. Hormones are at their peak, energy levels are high, tissues recover quickly, and the prostate is resilient. But after 50, everything changes. Recovery slows down, testosterone and other hormone levels shift, muscles and tissues become less elastic, and the prostate becomes more sensitive. If you masturbate too often, several times a day, or every day when your body is already tired, you may find that instead of feeling relaxed, you end up feeling drained. The prostate can become sore or swollen, pelvic muscles tense, and overall energy drops. These are your body's warning signals saying, "Slow down, I need a break." Ignoring these signals can lead to chronic irritation, urinary issues, or even weaker erections over time. For most men over 50, a healthier rhythm is around 2 to 4 times per week. Though everyone's body is different, the key is to pay attention. Do you feel refreshed and relaxed afterward, or fatigued and uncomfortable? Your body will tell you the optimal balance. Remember, masturbation after 50 is not about limiting yourself. It's about optimizing your health, preserving energy, and preventing avoidable strain on your body. Mistake number 2: rushing. Next up, rushing. Many men treat masturbation as a task to get through, just before bed, or to relieve stress, without paying attention to their body. The problem is that rushing increases friction, puts unnecessary strain on tissues, and reduces pleasure. Over time, this quick approach can cause skin irritation, tiny micro-tears, or nerve numbness. It also trains your body to associate sexual pleasure with speed, which can affect performance with a partner, sometimes leading to premature ejaculation, difficulty controlling arousal, or less satisfying intimacy. Tip: slow down. Treat masturbation as a chance to tune into your body, relax, and explore sensations. Focus on breathing, allow your mind to engage, and enjoy the process without rushing. Not only will this reduce irritation, but it can also improve sexual performance and make the experience far more pleasurable. Think of it as a mindfulness practice, connecting with your own body, noticing what feels good, and giving yourself time. Men who adopt this approach often report better control and more satisfying intimate experiences. Mistake number 3: ignoring lubrication. As we age, natural lubrication decreases and skin becomes thinner and less elastic. Many men ignore this and skip lubrication entirely, which increases friction and risk of irritation or discomfort. Using a high-quality lubricant can make a huge difference. It protects delicate tissues, reduces friction, and makes the process smoother and more enjoyable. This small adjustment alone can turn masturbation from something draining into a supportive, healthful activity. Combined with moderation, mindfulness, and attention to your body, lubrication ensures that masturbation supports prostate health, pelvic muscles, circulation, and overall well-being. Neglecting lubrication, on the other hand, can lead to unnecessary irritation, soreness, and even long-term discomfort. Mistake number 4. Replacing intimacy with masturbation. Masturbation is healthy, but problems arise when it becomes the only source of sexual expression. Physical touch, emotional connection, and shared intimacy with a partner are incredibly important, not just for pleasure in the moment, but for long-term physical and mental health. Oxytocin, known as the bonding hormone, rises during close physical contact. It helps reduce stress, improves mood, and supports cardiovascular and sexual health. If masturbation is your only form of sexual activity, you might notice lower energy, reduced overall satisfaction, and even emotional fatigue over time. Tip: maintain balance. Masturbation can be part of a healthy sexual routine, but prioritize real intimacy whenever possible, physical, emotional, or both. Combining solo and partnered sexual activity supports hormonal health, emotional well-being, and overall vitality much more effectively than relying on masturbation alone. Mistake number 5. Ignoring your body's signals. After 50, many men notice heaviness in the pelvic area, mild discomfort after masturbation, or changes in urination. These signals are not just part of aging. They are your body communicating with you. Pelvic heaviness can indicate an overworked prostate. Pain or discomfort might signal tissue strain from frequent or aggressive stimulation. Changes in urination patterns can indicate an irritated gland. Tip: listen carefully, rest when needed, adjust frequency, use lubrication, or adopt gentler techniques. Addressing small warning signs early can prevent larger problems down the line and ensure that sexual activity, both solo and with a partner, remains pleasurable and safe. Ignoring these signals doesn't make them go away. It often makes things worse over time. Your body is giving you valuable feedback. The wisest approach is to pay attention. Mistake number 6. Guilt or shame. Finally, let's talk about guilt and shame, one of the heaviest burdens men carry, especially as they age. Some believe masturbation is wrong or weakens you. Others feel ashamed due to cultural, religious, or societal pressures. These feelings can seriously interfere with sexual health, energy levels, and self-confidence. Masturbation is a natural, healthy process when approached mindfully. Letting go of guilt allows you to enjoy it without stress and integrate it as a normal part of your sexual and emotional life. The harm comes not from masturbation itself, but from compulsive, excessive, or guilt-driven behavior. When practiced thoughtfully, masturbation supports prostate health, circulation, stress management, and sexual function. It can be a valuable tool for maintaining both physical and emotional well-being, even after 50. Putting it all together. Masturbation after 50 is completely safe, but certain mistakes can reduce its benefits. Excessive frequency, rushing, ignoring lubrication, replacing intimacy, ignoring body signals, and carrying guilt or shame. Replace these habits with moderation, mindfulness, self-care, and self-respect. Doing so will protect your prostate, maintain erectile function, preserve energy, boost confidence, and support overall health and well-being. You're never too old for masturbation, but you are wise enough to listen to your body. Pay attention to its signals, care for yourself, and use masturbation as a tool for health, energy, and vitality, not as a source of exhaustion or stress. I'm Stephen Grant, and thank you for joining me today. Subscribe to the channel for practical advice on men's health, sexual well-being, and vitality after 50.